Good morning. Good morning, ladies and gentlemen. Today it's my honor to have a great opportunity to present my research work entitled Use of Demineralized Bone Matrix to Increase Healing Capacity in Management of Atypical Femoral Fracture, a preliminary report. An atypical femoral fracture is some type of fracture that has specific characteristics and associated with some drug use, especially the bisphosphonate. The problem with this fracture is the outcome after the treatment. In a typical fracture group, there are more complications and use of longer union time than in typical fracture group, obviously. That's why we have a current recommendation for treatment this fracture, but the outcome is still poor. Teriparatide shows some benefit in some study, but it has some limitation about the compliance, contraindication in some cases, and considering about the serious complication. This poor outcome is caused from a decreasing of cell activity at the fracture site in the remodeling process. So, it is possible to use a low growth factor or bone graft to increase the cell activity and improve the healing. A demineralized bone matrix or DBM is so interesting because it provides both osteoconductive and osteoinductive activity, easy to use, and low complication. So we conduct the study to evaluate the effect of DBM as the add-on treatment in management of a typical femoral fracture. We assess the healing capacity and also the complication that may occur. For the method, this study was designed as the single-blind randomized control trial to compare between two groups of study. The control group, which received the standard treatment, and intervention group, who received the standard treatment add on the 2.5 milliliters of DBM. We include the patient who was diagnosed as a typical femoral fracture by ASBMR 2013 criteria, and exclude who had any contraindication for surgery, open fracture, or who received the prior surgery for this fracture. The sample size was calculated based on mean union time from previous study in Rama TPD Hospital. The total sample size was 22 patients, 11 for each group. When the patients were diagnosed as a typical femoral fracture, they were allocated into the two groups of study with the block of four randomized method. All of the patients was undergone the surgery with allocation concealment. After the fixation has finished, the envelope was open. If the patient was in intervention group, the 2.5 milliliters of DBM was injected to the fracture site via mini-incision technique. Then the same post-operative protocol and 6-week interval of follow-up were applied to assess the outcome. For data collection, we collect the factor that has influence on the bone healing and divide into the 6 groups as shown. For outcome measurement, the primary outcome is union time. We assess the union time with the radiographic union score of the tibia that apply to the femur. The cut point of 8 was used to diagnose the fracture union. And the secondary outcome is complication rate, such as the allergy, infection, delay union, non-union, and revision rate. For data analysis, all of the data was analyzed with the SPSS program. The continuous data with student t-test or man with EU test, and the continuous data with the student t-test or man with EU test, and the categorical data with chi-square or feature exact properly. And this is the result. 16 patients have been enrolled in this study, 9 for control group and 7 for DBM group. The mean age of patients in this study was about 33 years old, and the majority of cases was female subtrochanteric fracture and had history of bisphosphonate use. All of the patients in this study achieved the union without revision surgery. Comparing between two groups, for demographic data, there were no significant difference between two groups in all parameters in demographic data. For the outcome, the union time in control group was about 20 weeks, while in the DBM group was about 14 weeks. There are some difference, but not statistically significant. For the complication, We found the delay union in 3 patients in control group and 1 patient in DBM group, but no significant was detected, and other complications were rare. For discussion, 16 patients have been enrolled and used to analyze in this study. We observed that about 1/3 of patients in this study had no history of bisphosphonate use, and no serious complication was detected from the use of DBM in this study. About the outcome, in DBM group, there are some trend to use a shorter union time and has a less delay union than in control group, similar in previous study, but all of them has not reached a significant difference yet. I think it may be from some limitation from in this study about the small sample size and high variety among the sample size. Lastly, for conclusion, for a preliminary report, our study show a possible benefit of orthobiologic agent, the DBM, in management of atypical femoral fracture, but more number of samples is needed to provide more specific results. Thank you for your attention.